Okay, hopefully the audio is working. Hang on a second. Cool. Okay, so this slide is going to be about tension type headaches. We're first going to go over sort of the definitions and characteristics of this type of headaches and what we know are some of the causes, risk factors, things like that, and the contributors. And then we're going to talk about how physiotherapy is going to help with management, as well as other forms of management and therapy for the tension headaches. So, to start off with, tension headaches are the most common benign type of headache. So, benign meaning in this case not actually causing physical harm, and it's not a pathology, but it's something that people deal with on a constant basis. Other types of headaches will include migraine, cluster headaches, and new daily persistent headaches. Those three can actually cause some harm, can be as a result of harm to the body and to the brain in some form or capacity. So the ones that we're going to talk about today aren't actually the ones that are causing any damage, but need to be managed in some way. So researchers found that approximately 38% of individuals experience tension type headaches each year, and there are two main types of tension headaches that we categorize them in, which is episodic and chronic. The episodic tension headaches, you want to characterize the episodic and chronic by the time frame. So if these headaches occur less than 15 days out of a month, then patients usually report feelings such as like a tight band, like pain and pressure around their head or like around the neck area as well. And these headaches are often both sides, bilateral, but they can be one side. And they range from mild to moderate in intensity, and don't really have any of the associated symptoms that you can have with headaches, such as nausea or, nausea, throwing up, anything like that. That's usually what you can get with migraines, but the episodic type, you're not going to get that, and it's less than 15 days out of a month. So that's the main point, the 15 days. The second type is chronic. So with the chronic tension type headaches, they're categorized by symptoms that persist for 15 or more days within a month, for 3 consecutive months. Because of basically the moderate to severe, you can get some severe chronic tension type headaches. This type of headache is more like, you consider it as more debilitating than the episodic type, as well as feeling you can get feel the same pressure around the head in a band, but you can also get the nausea as well, and obviously it's over a long period of time. So episodic and chronic are the two types. So now we're going to move on to sort of the causes. So what can be the reasons why you can get these? And to this day, it's actually unclear and not definitive as to there being a single reason. So there's no direct causality, but there are several contributors that are thought to, based on evidence and testing, to be the contributors to the tension type headaches. It was once believed that these headaches were to do with psychological stress, muscular contractions of the shoulder, neck, scalp, jaw, but actually those theories have since been rejected when put to more testing more recently. Now it's sort of more looking towards neurotransmitters in the brain, blocking serotonin. The nuances of that aren't really important in the idea of physio, but it's something that we are starting to understand a little bit more, but as I mentioned, it's still not 100% certain as to what the main cause is. So if there isn't one specific cause, we do know that there are some contributing factors in someone's life and patient's life that cause this. So are contributing to it. So stress is one thing. So high stress. If you suffer from depression, anxiety, also if like posture, if you hold your head in one position for a very long period of time, let's say an abnormal position, you can get a lot of tension in the neck muscles, cervical flexor extensors, and as a result, increased pressure and get headaches as a result of it. Sleeping in an awkward position or in a cold room is seen to be contributing. Any eye strain, looking at screens for too long, or just under bright lights, strain in general. There's also drugs or alcohol, overexertion. If you skip a meal, long-term chronic injury, so not chronic injury, but acute injury that happened in the past that is chronic over a period of time. Let's say whiplash is one of those major ones. Grinding your teeth in your sleep, as well as clenching the jaw, which are two things that are known to be a result of high levels of stress. Some medications cause tension headaches, arthritis, and hormonal changes. So it's a long list there. So there's a lot of things that can be contributing to the tension headaches, but not, or you might be suffering with stress, anxiety, and drunk too much on the weekend or something, and that's the reason why it has. That's three different contributors in one. Everyone's capable of having at least one of those things to be the main contributor. So out of that, you've got to have a look and make sure that you are reducing that as much as possible. Make sure you're eating enough. Make sure that you're dealing with your stress as much as you can. Us as physios, we can point towards some ways of improving that, which have actually been spoken in the previous live to do with stress. But at the end of the day, it's your responsibility to take your day-to-day stress levels. So now we've gone over the causes. Let's talk about the possible management, right? So there's two main options you've got: medication and/or physical therapy. So with medication, you have some options. So the medication, it's actually seen to be more effective in patients with episodic rather than chronic types, as we mentioned at the start. So keep that in mind. If you're dealing with episodic, this is probably what you want to go for, medication. So there's over-the-counter analgesics, ibuprofen, aspirin is another one, paracetamol is another one, which, when they experience pain in 1 or 2 days out of the week, ibuprofen and aspirin especially has been seen to be much more effective than paracetamol at treating pain. And individuals experiencing this type of headache you should stay away from opioids such as codeine, dihydrocodeine, proxifene, I think is the name of it, dextroproxifene, which is DTP, which is another thing that you can have, which is an opioid, and those. So out of ibuprofen and aspirin, those are the best options you probably got there, and you want to avoid the opioids. And that can be effective for episodic tension headaches, but there's a problem with that, and we'll delve into that later as to why it might not be as effective. Secondly, there's the physiotherapy side of things. So we'll talk about this briefly. Obviously, it's better if you can come to clinic so we can talk about these kind of things if you are dealing with the headaches, because we can go over specific exercise therapy that can be beneficial. But if we're looking at the evidence, a trial found that physical therapy can have significant effects on the frequency and the intensity of the fact of when you get these tension headaches. And in this specific trial, it found at post-treatment and 6 month follow-up time period, that's when it was the most effective when managing chronic tension type headaches specifically, so the chronic type. And the following has also been found to be effective in terms of physiotherapy practice. There's patient education for proper posture. So, how I mentioned about holding a position, that can be really effective. A home exercise program, if not in the gym. From our perspective, we can do passive manipulations on the neck, the cervical spine joints, the facet joint specifically. We can mobilize that. And that's been shown to be effective to reducing that kind of the tension. Cryotherapy, i.e. like cold packs, basically. Acupuncture, which is something that we do offer at the clinic as well. Massage therapy, especially trigger point focus therapy around the neck region, that can be really effective. And also, just it's important that that you are understanding of pain, and we give pain education to better help you manage that type of pain. Now, the reason why I mentioned that physical therapy is likely better than just medication, as I mentioned earlier, it only really deals with episodic. And if you're chronic, which is someone who is likely, if you're dealing with the tension headaches for a long period of time, you're going to be sick of it. So the best thing to do is get additional therapy rather than just taking ibuprofen, which is not getting to sort of the root issues that you're dealing with. So it's better to deal with chronic type if you have physical therapy as well as medication. As well as the fact that spinal manipulative treatment appears to be as effective as some drugs in producing short-term benefit as well. So we know that in total, in the short and the long term, the episodic and the chronic physiotherapy does have greater benefits overall. So that's tension headaches in a nutshell, and how physiotherapy can help it. And hopefully you learn something from this live. Okay. Have a great evening and take care.